السلام عليكم. اليوم بهذا الفيديو راح أتكلم عن الجزء الثالث والأخير من موضوع The relation of milk and bone remodeling with age in orthodontic treatment. As we remember in a previous part, I talked about what's the factor that affecting bone remodeling. I talked about the nutritional factor and aging factor. Today I will talk about the hormonal factor. In this part, I will talk about the third factor, which is hormonal factor. The hormonal factor, the endocrine system in our body produce and secrete hormone. The meaning of endocrine system in our body is the collection of the gland that produce hormone for a specific function in our body. One of these hormone or these glands, major glands in our body, as seen in this picture, such as pituitary gland at the base of the brain. Also the thyroid gland as the butterfly-shaped gland at the base of the neck. And the parathyroid gland is the gland behind the thyroid gland. So this is the example of one of the major glands in our body, in our endocrine system. So these glands produce and secrete hormones. The hormones are the tiny chemical messenger in our body, produce a specific role in our body. Some of these hormones can start process and other can end the process in our body. So is secreted for a specific role in our body. For example, they control bone and development, bone growth and development. Also can control sleep, emotion, stress, metabolism in our body. Many of these hormones interact with the skeletal system. These hormones are involved in controlling bone growth and development. Maintaining bone when it is formed and remodeling it is very responsible for bone remodeling. For example, bone remodeling need coordinated between the osteoblast and osteoclast cell. So this regulated by hormone, this activity regulated by hormone. So hormone is also responsible for growth of the bone and the development of the bone. So if there is any problem in the endocrine system, this may lead to any problem in our body, facing a problem during puberty, during managing stress, also problem in the growth of bone and the development of the bone. Also, if there is any problem in the endocrine system, you can get weight easily or lose weight easily. So, healthy endocrine system meaning healthy body and happy body. Hormones can be divided into hormones that influences the osteoblast cell and hormones that influences the osteoclast cell. We know the osteoblast cell is responsible for bone forming, cell responsible for bone formation. So what's the hormone that influences these cells? The hormone that affects this cell, such as growth hormone, thyroxine, sex hormone, and calcitriol. So all these hormones secreted by a special gland in our body, by our endocrine system. First of all, growth hormone. Growth hormone is secreted by pituitary gland. As we remember in the first slide, pituitary gland is lying on the base of the brain, at the base of the brain. The position of it at the base of the brain. One of the hormones secreted by the pituitary gland is the growth hormone. The growth hormone triggers the chondrocyte. As we know, the chondrocyte is the cell that's responsible for cartilage formation. So it triggers the chondrocyte proliferation in epiphyseal plate in the bone, resulting in increasing the length of the bone. From its name, growth hormone, so it is responsible for growth of the bone and development of the bone. So it triggers the chondrocyte cell, chondrocyte proliferation. This is responsible for increasing the length of the bone and also increase the retention of calcium, which enhance the mineralization and the stimulation of osteoblastic activity, which improve the bone density. So from its name, growth hormone for bone growth and development. The other hormone is the thyroxine. Thyroxine is the hormone in two forms, T3 and T4 hormone. This thyroxine hormone secreted by thyroid gland. Thyroid gland is a butterfly-shaped gland, as seen in this picture, at the base of the neck, secreted thyroxine hormone T3 and T4. T4 is the active form of the thyroid hormone. This hormone is very important for metabolism in our body, regulate the metabolism in our body, and also promote the osteoblastic activity and synthesis of bone matrix. The other hormone is the sex hormone. During puberty, the sex hormone, we know the sex hormone is the estrogen in girl and testosterone in boy. Also, promote the osteoblastic activity and the production of bone matrix. In addition to that, are responsible for growth spurt. Growth spurt, this period in our life, meaning the growth very fast, quickly and suddenly, very fast in a short period of time. So, this hormone, these sex hormones, are very responsible for the growth spurt that occur during adolescence. They also promote the conversion of epiphyseal plate into the epiphyseal line. Epiphyseal plate, as seen in this picture, in the long bone, epiphyseal plate is responsible for cartilage formation. And this cartilage formation converted to the bone, epiphyseal plate converting to the bone during adolescence for lengthening the bone. So the sex hormone promotes the conversion of this epiphyseal plate into the epiphyseal line, meaning cartilage to its bony remnant, help it to convert to the bone, thus bringing an end longitudinal growth of the bone, meaning increase the length of the bone. So it's very important for bone growth and development. Other hormone that responsible or influence the osteoblast cell is the calcitriol. We remember in a nutritional factor, calcitriol is the vitamin D, the active form of vitamin D. So why we call it hormones? Vitamin D, as we know, we can obtain vitamin D by sun exposure. The main source of vitamin D is sun exposure. When the sun exposure hits the skin, this is converted to the vitamin D. The body incorporates it into the chylomicron, go to the venous blood system, to the lymphatic system, into the liver. And the liver form it into the calcitiol, and in the kidney converted it to the calcitriol, the active form of vitamin D. So why we call it hormone? Hormones because its action, because vitamin D regulated by hormones and also have a receptor like steroid hormone. So it is not a true vitamin. It's act as hormones regulated by its function is regulated by hormones and have receptor like steroid hormones, and also you can obtain it by sun exposure. not by diet and supplement, because the diet contains a small amount of vitamin D. So it is not a true vitamin, it's like hormone, maintaining the calcium level in our body. So the active form of vitamin D is produced by the kidney and stimulates the absorption of calcium and phosphorus from the digestive tract and increase renal tubular reabsorption of calcium, thus reducing the loss of calcium in urine, meaning maintaining the calcium level, calcium and phosphorus level or phosphate level in our body, and reduce the loss of calcium in urine, meaning promote healthy bone formation by calcification of osteotissue. So this hormone that influences the osteoblast cell. Other hormones that influence the osteoclast cell, we know the osteoclast cell is the cell that's responsible for destroying bone, is the destroying bone. These hormone, parathyroid hormone and calcitonin. Parathyroid hormone, from its name, is secreted by parathyroid gland. Parathyroid gland is the gland that's lying behind the butterfly-shaped thyroid gland, as seen in this picture. It's lying behind the thyroid gland. It is a small 4 size gland behind the upper loop and lower loop of thyroid gland, behind the superior loop on the right of the left superior loop of thyroid gland, and two inferior gland behind the inferior loop, right and left inferior loop of thyroid gland. This stimulates the osteoclast formation or proliferation. As the result is calcium released from the bone into the circulation, try to increase the calcium level in the blood. When the calcium level in the blood is reduced, so the parathyroid hormone try to increase the level of calcium in our blood or in our circulation. Parathyroid hormone promotes the reabsorption of calcium by the kidney, which can affect the hemostasis, meaning reduce the loss of the calcium in urine to maintain or to increase the concentration of calcium in our blood or in our circulation. Also, the parathyroid hormone affect on the small intestine. The small intestine is affected by parathyroid hormone because another function of parathyroid hormone to increase the concentration of the calcium in our circulation is to stimulate the synthesis of vitamin D. And because vitamin D promotes intestinal absorption of calcium from the food, so parathyroid hormone indirectly increase the uptake of the calcium by the small intestine, as seen in this picture. Parathyroid hormone regulate the concentration of calcium in our circulation. So when there is hypocalcemia, meaning low blood calcium, this stimulates the parathyroid gland to secrete the parathyroid hormone. Parathyroid hormone acts on the bone, on the intestine, and on the kidney. On the bone, activate the osteoclast, meaning taking the calcium from bone. As we know, our bone is the bank of calcium. You can form calcium and withdraw calcium as needed. This depends on the level of the calcium in our circulation. So if the level of calcium is low, so parathyroid hormone activates the osteoclast and so they can take calcium and phosphate from bone to release it in the circulation. And in the kidney reduce loss of the calcium in urine because it promotes the activation of vitamin D. So vitamin D reduce the loss of calcium in urine. And also in the intestine increase the calcium absorption from food. So this is the effect of parathyroid hormone. Another hormone that influences the osteoclast cell is the calcitonin. Calcitonin is the hormone that's secreted by thyroid gland by a butterfly shaped at the base of the neck. This gland, as we remember, produces thyroid hormone that promote osteoblast activity and also produce calcitonin or secrete calcitonin that influence the osteoclast activity. And this inhibits the osteoclast activity and stimulates the calcium uptake by the bone, thus reducing the concentration of calcium ion in the blood. So this is the opposite to the action of parathyroid hormone. As seen in this picture, calcitonin, when there is high calcium in our circulation, need to reduce the level of calcium or the concentration of calcium in our blood. So this helps stimulate the thyroid gland to secrete calcitonin hormone. This hormone also acts on the bone, on the kidney, and on the intestine. On the bone, promote deposition of calcium, meaning uptake of calcium by the bone. So inhibit osteoclast formation and stimulate the osteoblast formation. Also act on the kidney, meaning inhibit the calcium reabsorption in the kidney, so excreted in the urine, increase the excretion of calcium in the urine to reduce its concentration in our blood. Also in the intestine, inhibit the calcium absorption by intestine. Inhibit the absorption by intestine. Try to reduce the concentration in our blood. So lower the calcium level in our blood. So this is the opposite to the action of parathyroid hormone. So as the conclusion of parathyroid hormone and calcitonin that influence the osteoclast activity, blood calcium level can maintained or regulated by these hormones, as seen in this picture. If the calcium level rise above the normal, so this stimulates the thyroid gland to produce calcitonin, hormone calcitonin. So hormone calcitonin act on the bone, as we remember in the previous slide, act on the bone, on the kidney, and on the intestine and try to decrease the calcium in our circulation. But if there is hypocalcemia, this stimulates the parathyroid gland to produce the parathyroid hormone to increase the level of this, to increase the level of calcium in our blood. So the blood calcium level is maintained by calcitonin and by parathyroid hormone. In this picture, I put the summary of each hormone. So as the conclusion of this lecture, how we can get healthy bone. Healthy bone, we can get healthy bone for healthy body. First of all, balanced diet during pregnancy. Balanced diet during pregnancy. Healthy bone start from pregnancy. Pregnant women must have calcium in her diet. Her diet should be balanced, contain several types of mineral and vitamin, especially minerals, especially calcium, because calcium keeping her and her baby's bone as healthy as possible and strong as possible, because calcium is the critical mineral for bone health, for building strong bone and strong teeth for her baby. So balanced diet is very important during pregnancy. Especially, her diet must contain milk and its dairy product because the calcium is the critical mineral for her bone and her baby bone and teeth. Also, the protein is very important for maintaining the body weight of the baby. Another thing to get healthy bone is minerals. Minerals meaning our diet should contain balanced amount of everything, of every type of minerals and vitamin. Mineral incorporated in our bone. The bone density is the measurement of how mineral in our bone, how mineral and calcium in our bone. So, mineral is very important for building strong bone. As we remember in the first of this lecture, in the second part, nutritional diet or nutritional factor, I talked about there is a certain nutritional diet that's very important than the other for bone health. I talked about the calcium because it's a critical mineral. Also, another mineral is very important, or certain nutritional diet very important for bone health, calcium and vitamin D. Vitamin D because without vitamin D, calcium cannot absorb. Also vitamin K. Vitamin K is very important for coagulation. In addition to that, to the coagulation function is also help to modification of osteocalcine. Osteocalcine, this protein, help to bind the calcium into bone. So it's also very important element or vitamin, very important vitamin for bone health. Also magnesium. 60% of magnesium is in the skeleton, and the magnesium is very important for every cell, for the function of every cell in our body. Vitamin C also important for collagen synthesis and also cofactor for vitamin D and help the absorption of calcium. And don't forget omega-3 fatty acid is also very important for bone health because it reduces inflammation that may interfere with the function of osteoblast and also help in the calcification of osseous tissue. So these certain nutritional diet, this summary of certain nutritional diet that our food must contain them to build healthy bone, to build strong bone or obtain healthy bone. And don't forget to obtain healthy bone, milk basic protein. Milk and its product. We must consume milk every day for maintaining calcium in our body because milk is the rich source of calcium. And not only rich source of calcium, milk also contains 3% of its component, it contains protein. So this protein is very important for increasing the bone formation cell, increasing the function of, or increasing how the cell osteoplastic cell, the bone forming cell, promote the function of bone forming cell and inhibit the function or regulate the activity of osteoclast and help to reduce the bone loss that occurring with age. So milk not only contain calcium but also contain protein that's very important for bone formation and bone remodeling. And don't forget, when we need healthy bone, also the exercise help us to obtain healthy bone. Exercise mechanical stress in our bone. This stimulates the deposition of mineral and collagen fiber, which is the internal and external structure of our bone. This means increase the bone density. So we see that, or we conclude that people with bearing exercise with at least twice per a week, half hour twice per a week exercise, that's getting exercise regularly, have thick bone mass than people with low density bone, than people with sedentary lifestyle, having low density bone, weak bone, that's susceptible to the fracture in the future. So the exercise also protect our bone and help us to build strong bone, thick bone mass, because the stress, mechanical stress due to the exercise, help us to build strong bone, help us to help the bone to deposit mineral tissue, mineral salts and collagen fiber. Another thing is the body weight. Also, maintaining body weight is very important for healthy bone. Too thin body weight or too thin weight, meaning being too thin, this affects the bone, affect the health of the bone. Being too thin meaning loss of the bone density, and this have harmful effect on the bone. And also being too heavy affect the bone by make the bone susceptible to the fracture, make the bone weak due to the stress. So, being too thin or too heavy have negative effect on the health of the bone. Maintain healthy weight, normal or slightly than normal, is the good way to protect our bone, because repeating loss weight or gaining weight affect the bone mass, reduce the bone mass, and this reducing the bone mass can't reverse when regaining the weight during our lifetime. Also, the calories in our diet. Studies show that person taking few calories, less than 1000 calories per day, also can affect the bone, because this help to create rebound hunger and reduce the bone or the muscle mass, and this affect the bone. So, healthy diet with regular exercise, with normal body weight and balanced calories, no less than 1200 calories per day, with the food rich in certain nutritional diet, rich with balanced diet, rich with nutritional elements such as calcium, vitamin D, magnesium, vitamin K, fatty acid, all these things very important to build healthy bone. And the diet is very important during a teenager, because 75% of bone is building during this age. The final thing that's very important for healthy bone is regular hormonal level. As we remember in the beginning of this part, I talked about the hormonal factor. That healthy endocrine system, meaning healthy bone, healthy body. Because there are many hormones affect the skeletal system. So if there is any problem in the hormonal level, this also can have a negative effect on the bone remodeling activity or bone remodeling process. Finally, in this lecture, we recommend that change the idea founded by most people that milk help in treating broken teeth or mobility of the teeth, and this is the wrong belief. Many people have wrong belief that milk can treat the mobility or can treat the fracture. The effect of milk, we must know, the effect of milk on the teeth is only before the eruption of the teeth. For this reason, the balanced diet for the pregnant women is very important for building healthy bone and healthy teeth of her baby, because the effect of milk on the teeth is before the eruption of the teeth. So balanced diet before the eruption, especially during pregnancy, because the teeth formed during pregnancy, is very important. So the effect of the milk only on the bone formation. Milk cannot treat the mobility of the teeth or the fracture of the teeth. It is irreversible, not reversible. The effect on the bone formation, on the bone remodeling. The effect on the alveolar bone is one of the supporting structure of the tooth, because the supporting structure of the tooth is the periodontal ligament and the alveolar bone. So, if there is any periodontitis, for example, that causes the mobility of the teeth, as we know, periodontitis is the inflammation of periodontal ligament or the supporting structure, is bacterial inflammatory disease. So if it is the mobility due to the periodontitis, consuming milk, because it contains calcium, can help to reduce the severity of the movement or the mobility that occur due to the periodontitis, because the effect of the milk help to reduce the bone resorption. Because if there is low calcium level in our body, due to the deficiency in our body, deficiency in calcium, deficiency in vitamin D, and also if there is osteoporosis, because osteoporosis affects any bone in our body, if there is any problem in our body, so the alveolar bone become weak. So if there is any inflammation in periodontal ligament, and also there is a resorption in alveolar bone, so this increases the stability of the movement, increase the severity of the mobility of the teeth. So can reduce the severe periodontitis or the severe mobility by helping to maintain the bone, the healthy bone, maintaining the bone formation, which is the supported structure of the teeth. So can treat the mobility, because teeth not fuse directly to the bone. Teeth fuse to the bone by periodontal ligament. So can reduce the severity, not treat it. Also, increased calcium intake may inhibit bacterial formation. Inhibit bacterial formation because calcium can protect the enamel, the external part of the tooth. The enamel can protect or strong it by mineralization, increase the mineralization of the enamel of the tooth. So this makes the tooth can fight the bacteria, so lower the occurrence of periodontitis and prevention of alveolar bone loss, and consequently better retention of natural teeth during life. Also, milk and its product, dairy product in general, should be prescribed during orthodontic treatment, because there is two relation between orthodontic treatment and diet, because rendering orthodontic treatment can affect the nutritional uptake or intake, and also diet can affect the speed of the treatment. Milk and its product should be prescribed during orthodontic treatment, because milk contains calcium and milk basic protein, so this can increase the speed of the treatment or help to assist the bone remodeling that occur during tooth movement or during orthodontic tooth movement. In orthodontic treatment, the tooth movement that occur in the orthodontic treatment can be assisted by milk and its product. In addition to that, milk and its product are soft diet. That's very important to prescribe soft diet during orthodontic treatment due to the appliance, to reduce the retention of food between the teeth. So we must put in our mind the effect of milk is on the bone formation, not on the teeth. The effect of milk on the teeth before the eruption, not after the eruption. Milk can strengthen the jawbone, which can help to keep the natural teeth as longer as possible and fight tooth decay by strengthening the outer surface of the tooth, meaning the enamel. Thank you for your listening. I hope you understand it and enjoy it. If you have any question, please contact me. And if you want to download this lecture, you can download it from the SlideShare Dr. Sarah Khatib. Thank you for your listening. شكرا لحسن استماعكم.